Tiffany. I'll be your nurse today. Could you tell me your name and your date of birth?
Katie Lindor, September 2nd, 1994.
All right, I have the correct patient. So I'm just going to be performing about a 20-minute assessment on you today. It's just going to be able to tell me how well the blood's flowing through your body and perfusing to your tissues.
Okay.
Yeah, so take about 20 minutes. Feel free to ask questions as we go. Do you have any questions for me right now?
Mm-mm.
Patient understands the purpose for this exam or assessment. So could you go ahead and empty your bladder for me and put this gown on with the ties in the back?
Mm-hmm.
All right, thank you. So are you comfortable in the room in regards to warmth, privacy, and light?
Mm-hmm. Yeah.
All right, patient is comfortable. All right, so I'm going to go ahead and get started. I'm going to ask a couple health history questions. So
Okay.
do you have a history of any diabetes, chronic kidney failure, or high blood pressure?
Mm-mm.
No? And have you been having any chest pain, shortness of breath, or palpitations?
Mm-mm.
And have you been having any pain or swelling with any skin changes or any noticeable veins in your lower extremities or any redness?
No.
No? And do you have a family history of diabetes, cardiovascular disease, or high blood pressure?
No.
No? Now, if the patient had answered yes to any of the pain questions, I would have gone and assessed it further using Old Cart's ice. All right, so I would then inspect my patient and note that she is the color of her ethnicity white. She's sitting up straight, she's quiet, her breathing's unlabored, she's alert, oriented. Yeah. All right, so I'm going to go ahead and check your head and neck just to see how well the blood's flowing. So I'm going to check her temporal and her carotid pulses. Check her temporal bilaterally. Feels normal. Check your carotid. And that felt normal. So I'm now going to check your upper extremities. If you could just pull your sleeves up for me. I would note that her arms are symmetrical to her body. She is the color of her ethnicity, white. There's no edema present. Her skin is warm. Her skin turgor is elastic. And I'm now going to check your capillary refill. It's less than 30 seconds. If I could just see your nail beds. I would note that her nail beds are 160 degrees. I'm now going to check your brachial pulse and your radial pulses for rate, rhythm, and amplitude. So her brachial pulses are equal with an amplitude of 2+, and her radial pulses are equal with an amplitude of 2+. Now I'm going to check her lower extremities. I would note that her legs are symmetrical to her body. She is the color of her ethnicity, white. There's no edema present. I'm now going to check your popliteal pulses for rate, rhythm, and amplitude, and they are equal with an amplitude of 2+. I'm going to check your pedal tibialis. And they are equal with an amplitude of 2+, and I'm going to check her dorsal pedis, and they are equal with an amplitude of 2+. I would then note that her chest is symmetrical to her body. There are no abnormal pulsations. So I'm now going to listen to your apical pulse for a full minute, which is 5th intercostal space, mid-clavicular line. So if I could just go ahead and have you lie back. Still close to you.
Pretty strong.
So her apical pulse was regular with it being 74 beats per minute. So that was regular, good. I'm now going to listen to your carotid arteries just to check the blood flow. So if you can just take a deep breath in and hold it.
Okay.
Deep breath in and hold. And breathe out. And deep breath in and hold. Release. There were no bruise present. So I'm now going to listen to your 5 heart valves. And I'm going to listen with my diaphragm and then my bell. And I did listen to with my bell on her carotid. Okay. Just breathe normally. I am now going to listen with my bell. All right. So I would then note, everything sounded good. I would then note that her S2 was louder than her S1 over her aortic and pulmonic valves. S1 and S2 were equal over Erb's point, and S1 was louder than S2 over her tricuspid and mitral valves, and there were no murmurs present. So that's all for this assessment. The provider will be in shortly. Do you have any questions for me?
Mm-mm.
No?
Thank you.
All right.